So what happens if you ignore a mild scoliosis? Mild scoliosis doesn't necessarily mean harmless. Mild scoliosis, often defined as a Cobb angle between 10 and 25 degrees, might not seem like a big deal, but the important part is scoliosis is a progressive condition and a mild curve doesn't stay mild forever, especially during rapid growth in adolescence. So when a curve is left without any proactive care, even if it's mild, it can steadily increase in size and complexity over time. Without intervention, the spine's abnormal rotation and the lateral bend caused by scoliosis starts to increase as growth continues, making later treatment harder and less responsive. Waiting too long can cause something very manageable to turn into something more challenging. Watch and wait should be replaced with watch and act early. So what are the common signs it is getting worse? Progression often happens quietly. Watch for uneven shoulders becoming more noticeable, one hip appearing higher than the other, or a more visible waistline asymmetry, rib prominence higher on one side than the other when bending forward. Clothes can start to fit unevenly also. So it's important to note the pain is not required for progression, and that's why visual and clinical checks matter more than just how does it feel. So what can you do now to stop progression? It's very important to get a scoliosis-specific assessment, not just a posture check. The curve type, the Cobb angle, and the growth surge do matter. Misdiagnosis or a wait-and-see approach can delay effective care. Monitor during the growth window. The growth spurts are the highest risk time. Regular follow-ups with someone trained in scoliosis can help catch small changes early and make sure that non-surgical care is started effectively and early. Mild curves respond best to early intervention, and options can include scoliosis-specific exercises such as ScoliBalance. Corrective bracing is also very important, and the earlier we start these programs, the more effective they are. So why does waiting make things harder later on? Early action keeps options open and larger curves become stiffer, so it's better to treat the curves earlier when they're smaller. Correction becomes more difficult and treatment options narrow if the curve is larger and more stiff, and surgery discussions happen sooner. Mild scoliosis isn't something to panic about, but it is something to take seriously. Early assessment, regular monitoring, and timely non-surgical care can stop progression before it becomes a bigger issue. At Scolicare, we focus on catching scoliosis early and acting at the right time so mild curves stay mild and families stay confident.